Joining me now, Dr. Anthony Fauci, Chief Medical Advisor to President Biden, also the Director of the National Institute of Allergy and Infectious Diseases. Thank you for joining us. I was just looking at where I am, New York City, formerly the epicenter of the pandemic here in the United States. The positivity test rate is 15%. That's an intensity not seen since January. The number of hospitalizations are up as well. How worried are you at this moment, Dr. Fauci, about the BA.5 variant, and what do we need to know about how to protect ourselves?
Well, it's something we absolutely need to take seriously. It has a transmission advantage over the prior variants that were dominant. The dominant variant was first BA.1, then BA.2, then BA.2.1, 2.1, and on. And then you get to BA.4-5, particularly BA.5, which clearly has a transmission advantage, which is one of the reasons why we're seeing throughout several regions of the country, including in particularly the New York area, you're starting to see cases go up. So it needs to be taken seriously. Everybody wants to put this pandemic behind us and feel and hope that it doesn't exist. It does. However, the good news is that we have the capability and the tools to address it. And we just need to utilize those tools. For example, getting vaccinated if you're not primarily vaccinated. If you're due for a booster, use a booster. And when you're in an area where you have a high dynamic of infection, and we're not talking about mandating anything, but we're saying recommending people when they are in indoor congregate settings to wear a mask. Those are simple, doable things that can help prevent us from having even more of a problem than we're having right now.
But given where you see the American people and their mindset, and frankly, their exhaustion right now, how much harder a sell is it for you now than it was, say, a year ago to say, when you go indoors, wear a mask?
You know, no doubt about it. You're absolutely correct. It becomes a hard sell. We don't want people to panic. We don't want this to disrupt their lives the way it has all of us over the last 2 to 2.5 years. But you have to remember, we're still dealing with an issue, and you can deal with it without necessarily disrupting your way of life by doing some simple things. Getting tested, for example. Tests are widely available right now. If you're going to a function or you have someone in your family who's a vulnerable person, that you want to make sure that you are not exposing yourself to them if you get infected, and you might actually not have any symptoms at all. So testing is an important mitigation. The next is vaccination. The next is boosting. And if, in fact, the person does get infected, if you are in a risk group, widely available now are very effective therapies. So the point I'm making is that we don't want people to panic and feel, oh my goodness, we want to get this over with, and they keep telling us things that we have to do. What one has to do is really relatively simple, but the dividend of that is extraordinary because you can prevent yourself from getting infected. And certainly with the vaccines that we have, they are still very effective in preventing you from progressing to severe disease if you do get infected.
So given that, Dr. Fauci, is it your recommendation to President Biden that he should expand the second coronavirus booster shot to adults under 50?
So first of all, let's make sure you get what the sequence of events would be, because that's really important. It's not going to be President Biden that's going to extend it. It's going to be something that we leave fully to the authorities responsible. This is an FDA authority situation, which if they give the authority to extend the fourth booster to people less than 50 years old, and the CDC is in concordance with that, then it will happen. Right now, we're in active discussion about that. You had mentioned that in the opening to this particular interview, that it was reported in the New York Times that we are actively discussing the feasibility and advisability of being more flexible in allowing for vaccinations for people less than 50 for their fourth dose. And the only thing I can say is that we're actively discussing it, but the final decision about this will be at the FDA level and then ultimately with the CDC with a recommendation or not.
Do you have a sense of when that might come, when that decision might come, Dr. Fauci?
You know, I really can't give you a day or a date on it, but I would think it's something that is going to be reasonably soon, because in the conversations that our team, which includes the FDA and the CDC and myself and Dr. Jha and others, that we've been discussing this actively, and I would not be surprised if within a very reasonable period of time, you're going to be hearing something about it.
Dr. Anthony Fauci, thank you. It's always good to have you on the program. We appreciate your time, sir.